Hello, my name is Denise Ponce, and this is my oral mech examination. This is my sister Jasmine. She is 18 years old. Alright. Okay, Jasmine, so today we're going to look at different sections of your face for this oral examination. First, we're going to start off with your facial structures and functions. So just by looking at you here, is it okay if I touch your face? Okay. For your mouth, I don't see any drooping on either side of the corner. Your eyelids, they're very proportionate, meaning that one eye is not partially closed or completely closed. Now for your mandible and jaw, let's look at your mandible and jaw. Okay, so yep, it appears that they're both proportionate. There's no sign of drooping from one side more than the other. Your movement, there's no abnormal movements, and I don't see any facial grimaces, spasm, twitching, and no mouth breathing. Moving on to the evaluation of your jaw and teeth. Can you open your mouth? So open and close your mouth for me. Okay, the range of motion is normal. There is no TMJ noises. And now can you please give me a big smile? Beautiful smile. So the mouth symmetry, it's proportionate. There's no deviated side. Okay, now we're going to look into your teeth. And we're going to see if there's any missing teeth. All right, so can you please open your mouth for me? Okay. So we're looking for any jumbled, missing teeth, misalignments, spaces, dentures, or dental appliances, such as braces. So it appears that there's no missing teeth, no jumble, no spaces, no misalignment, no dentures or dental appliances, and your hygiene is good. Okay, now you're going to go ahead and bite down gently and then separate your lips so your teeth can be observed. So you're going to go like this. All right, thank you. So normal inclusion, approximately half a tooth ahead of your upper molar. Neutral occlusion, which means your upper and lower dental arches are normal. Okay. Now we're going to check your chin. It appears that you have no receding chin, so there's no overbite or underbite. Moving on to your lips, because those are very important for your speech production. Can you pucker your lips for me, just like this? Okay, the range of motion is normal. Symmetry appears normal. There's no drooping from one side or the other, and your lips do remain closed while at rest, so there's no sign of mouth breathing or drooling. Your strength, now I want you to press the tip of your tongue against your lips, like this. No. Okay, so the strength is normal. Now can you smile for me again? Okay. Range of motion is normal. Symmetry, lips deviate at the same time, and there's no side that deviates more than the other. Now pucker and smile. So you're going to go like this. Okay, the range of motion appears normal and adequate for speech production. Okay. Now, listen to the instructions. I'm going to ask you to puff your cheeks for 5 seconds. Don't worry, I'll count. And then I'm going to place this mirror right underneath your nose. That way I can see if there's any fogging, if you fog the mirror, okay? Ready? So puff your cheeks. 5, 4, 3, 2, and 1. Okay, good job. So the lip strength appears normal. Nasal emission is good. There's no fogging. Moving on, your tongue evaluation. So we're going to look at the structure and the function of your tongue. So extend your tongue out for me. Okay, so the surface level appears normal. The size of your tongue appear appropriate in relation to your oral cavity. And then can you stick your tongue out and then lift? Okay, no frenulum, so that means that there's no tongue tie. Okay, go ahead. Now, when you extend your tongue, there's no abnormal movement, no spasm, no twitches, and there's no sign of atrophy, which means muscle loss. Okay. Now you're going to protrude your tongue, so you're going to stick it out, and you're going to stick it out and then bring it back in. So protrude and extract, okay? Go ahead. All right, thank you. So your range of motion and speed appear appropriate to your tongue. Excursion, you do not deviate to one side more than the other. Strength, what you're going to do is you're going to, inside your mouth, you're going to move your tongue right to left and press on your cheeks. Go ahead. Okay, so the pressure with your tongue blade appear normal, the strength. Okay. Now you're going to protrude your tongue again. You're going to move your tongue up, down, to the right, to the left, and then side to side on my count, okay? Go ahead and protrude your tongue. Okay, go up. Up, down, right, left, and then side to side. All right, thank you. Okay, so your range of motion and excretions are appropriate. No signs of groping, uncoordinated movement, or weakness. Okay. Now, moving on to your pharynx. I'm going to ask you to open your mouth again. Okay, let me go ahead and grab my little flashlight. Okay, open your mouth. Stick your tongue out. Okay, the pharynx color is normal. Tonsils are still there. Go ahead and close. Now we're going to observe your hard and soft palate, and I'm going to use my mirror again to look at that, okay? Go ahead and open. Okay, so your hard and soft palate look good. The coloration of the hard and soft palate appear normal along the midline. White and pink root is normal. Let's look at your arch and the width. Those appear normal as well. Normal range for speech production. Okay, go ahead and close, giving you a little bit of a rest. Next, we're going to look back inside and look at the growth and the if there's any signs of fistula or cleft. Okay. Oops. And then any gag reflex as well. Go ahead, open. Okay, so there's no growth, no fistula, no cleft, signs of repaired or unrepaired cleft, no signs of surgical remover of any portion of the hard or soft palate. And then gag reflex appears normal. All right, moving on to the last section. I'm going to ask you to produce a prolonged ah, and I'm going to look inside your mouth again, okay? Let me grab my mirror. Now, on my count, you're going to do that prolonged ah, okay? Go ahead, big, open your mouth wide open. Ready? Ah. Okay, go ahead and close. Your symmetry of movement appears normal. Posterior lateral movement is present. Your uvula appears normal and no nasality. Okay, so that is all for today. Thank you, Jasmine, for being such a good sport. And that is all. Thank you.